This is Rockback overhead breathing. So what we're doing here is we are trying to get expansion into the back side of the diaphragm and your whole back body here. And so this is also could be called modified inversion breathing. So we're kind of doing a slight inversion by elevating your knees here. So ideally maybe a little bit higher if you have like a bolster or maybe a few thick pillows, that would be a little bit better. But then you're gonna bring your forearms to the ground here. Slight tuck of your pelvis, so think of bringing your back pockets down towards your knees here. Slight tuck of the pelvis. You can kind of push the floor away here through your forearms. And then what I want you to do is inhale. Think of sending your breath down into the pelvis and into your back. Inhale through your nose. Exhale all the air out. Feeling those lower abs and obliques engage as you exhale all the air out. Pause at the end for a few seconds and then inhale again silently through your nose. Keep some tension in your abs as you inhale. That way you feel the air expand into your back rib cage and chest a little bit. And then exhale all the air out again like you're fogging a glass. So here, the focus is on that exhale. We're getting all of the air out. We're connecting with our lower abs and our obliques as we exhale. Those muscles are gonna help bring the ribs down. And then when we inhale again, we are keeping some tension in those abs so that we inhale into that entire back body, feel our rib cage expand, our chest expand a little bit. So by keeping tension in the abs, our breath has to go elsewhere. So it will go into the rib cage, into the back side of the rib cage, so that we can get some expansion back there. So this is a great exercise to work on that. You can also coordinate your pelvic floor during this exercise too. So when you're doing that good inhale, you're not only breathing into your back body, but sending that breath all the way down into the pelvis, feeling those pelvic floor muscles lengthen and release a little bit. And then on your exhale, as you're exhaling all the air out, you can think of gently lifting the pelvic floor as you feel those lower abs and obliques kick on too. So we can work on coordination of the pelvic floor as well in this position. But again, something maybe 5 to 10 inches off the ground to bring your knees up a little bit, and then that way it can really help you feel your breath and get that expansion where we need it to in this exercise.